My name is Tracy Cundit. I'm a 7th semester nursing student, and today I will be providing tracheostomy care and suctioning for a patient. So the first thing that I would want to do is go into my patient's room and assess them. So I want to identify her using her name and date of birth, introduce myself to her, let her know I'd be caring for her today. I want to listen to her lung sounds, make sure that she doesn't have any crackles or rails or advantageous lung sounds. I also want to note the rate and rhythm of her breathing, whether or not she's labored to breathe, and what her heart rate is. Typically, if they're having difficulty breathing, they're tachypnic. They can have tachycardia, and they have advantageous lung sounds because they can't clear their secretions on their own. So she does need to be suctioned. So I go out and gather my supplies, come back into the room, let her know what we're going to be doing. So let her know what the procedure consists of. I'm going to raise her bed to a working height for me, so I'm not bending over to care for her. And then I also want to provide her with some patient privacy. So I would pull this curtain behind me. I'm not going to pull it for the sake of the video because all of my suction equipment and oxygen tubing is back there. So once we're ready to get started, I'm going to go ahead and drape her with a towel so we keep her down as clean as possible. I'm going to perform some hand hygiene and clean my hands up. I want to turn on her, I want to hyperoxygenate her, so I'm going to turn her oxygen up. I'm going to turn my suction on between 80 and 120. I want to stay on the low end of that unless her secretions are extremely thick or difficult to get out, and then I can turn it up a little higher if needed. So now that she is in high Fowlers and good and oxygenated, I'm going to clean my hands one more time, and I'm going to go ahead and start getting my supplies out. So I'll open my suction catheter kit away from me and take my box out for my sterile normal saline and go ahead and pour that in. And then I'm going to don sterile gloves. So I'm going to do my non-dominant hand first. I did not touch the inner cuff there. I know it may look like I did, but my finger did not make contact. And don my dominant hand. And then I can throw this away, making sure to pinch the inside of my packaging. So I would throw that away. I can take out my suction catheter. And throw that package away. I want to wrap this around my dominant hand so I have control of it. So I'm going to go ahead and contaminate my non-dominant hand. And I want to remove her oxygen mask and hook my catheter up to suction. I'm going to test my suction and make sure that this catheter is nice and lubricated and working well. And then I'm going to let her know that we are going to get started. I would like Miss Opal to raise her left hand if she's at any time under distress or in pain or needs a break. That way we have a method of communication since she can't speak with me. And let her know that we're going to go ahead and go down in suction. So as I go down into the trach, I want to make sure that I don't have suction, and I go down until I meet resistance. And then intermittent suction as I come back out. And then I can give her a break if she needs. If she needs a break, and I can lift the oxygen mask back down to reoxygenate her if her sats are starting to deteriorate. give her a break for about 30 seconds, and then I'm going to go back down again. So I'm going to clear out my catheter again. But now I'm going to get started, and we're going to go down without suction to meet resistance, and then back up using intermittent suction. Until her secretions have been cleared. She sounds much better. Her rates and rhythm of breathing is much better. So I'm going to go ahead and detach my suction catheter. I'm going to pull her V-sponge. And I would wrap this up in my glove and take my gloves off and throw them away. For the sake of the video, I'm going to leave these gloves on. But I would go out and turn off her suction. So I would have these gloves will be off. I'm going to take her oxygen mask and put it back on and let her recover while I set up for the next portion. So I'm going to clean up my field here. This would go in the trash with my gloves. This would all go into the trash can. For the sake, I'm going to send it over here. And I'm going to grab my trach care kit. So I perform hand hygiene. I like to clean my hands before I open this. I'm going to open it away from me. Set up a sterile field for me to work with. Minding my 1-inch borders here to keep everything sterile. And then there would be a pair of gloves here. I like to go ahead and wash my hands one more time, so perform hand hygiene and don new sterile gloves, a new set of sterile gloves, so I can start setting up this sterile field for her. Okay, so in these kits you have hydrogen peroxide. I'm going to choose a container to put that in so that we can clean her cannula. So tear this open, put your hydrogen peroxide in a container. This package also comes with sterile normal saline. So I want to mix that half and half with my hydrogen peroxide. And then use the other half of the bottle to rinse. And throw that container away. So once I'm ready to get started, I'm going to go ahead and contaminate my non-dominant hand again. I'm going to take her oxygen mask off. Unclip her cannula. And set it in my hydrogen peroxide to soak. Using my sterile hand, I'm going to grab my brush and soak it in normal saline so that I can clean her cannula. So I'm going to brush the inside of this cannula out. Clean it. And then I'm going to soak that in normal saline. Use a sterile hand to grab the cannula. Tap off any excess water because I don't want to introduce that fluid into her lungs. And then use this sterile hand to replace her cannula until I hear it click into place. And then I want to assess that incision site in her phalanges if they need to be cleaned. So I would take my sterile 4x4s, or you can use Q-tips to do this, soaked in normal saline, and that sterile normal saline to get her cleaned up. So wring out your excess fluid. Clean your phalanges off. Clean underneath the phalanges around her incision site if needed, to ensure that her skin integrity stays good, that she's not at a higher risk of infection. using a new one of these each time that I wipe. So I would wipe and clean, throw this away, soak another, wipe and clean, and throw this away. Do that until she's completely clean, both at the incision side and around her phalanges. Again, you can use Q-tips if you want to do that. And then I want to make sure that she's dry, that her skin is dry before I change out her dressing, before I change out her trach ties and put any dressing on. So I'm going to take a dry 4x4 and dry her skin and her phalange, make sure it's good and dry before I put a new dressing on. So I would throw this away as well. And then I'm going to get ready to change out her trach ties. So if I had an assistant, I would have them hold this phalange in place so that it doesn't move or adjust as I loosen the ties up and put new ones on. I don't have an assistant, but she's pretty alert and orientated, so I'm going to let her lift her head for me and stay as sterile as I possibly can as I do this for her. So I'm going to have Miss Opal lift her head up for me so that I can get the new ties behind her head. So tie off some new ties for her. I want to make sure that I can fit a finger to 2 fingers in there so they're not cutting off her circulation or strangling her with her ties. And then you can remove these old ties after you secure the new. So if at any time during this procedure that she needs a break or she needs to be reoxygenated, you can put her oxygen mask back on her and give her a break if she needs. You just need to don new sterile gloves if you do that. You contaminate your gloves. She did great though. So I would take this, would take off my gloves. At this point you need to don new sterile gloves. So I would take these sterile gloves off. I'm going to throw that in the trash. I'm going to perform hand hygiene and put a new set of sterile gloves back on and get ready to change her V-sponge for her. So I'm sterile again. I'm going to find her V-sponge in the supplies here. You could use sterile surgical clamps for this too to help get this V-sponge up. The long Q-tips are nice. So I'm going to try to stay as sterile as possible, getting this new dressing around her incision site without injuring my patient. And once her V-sponge is up far enough, I'm just going to grab the edge here and pull it so it's secure around that trach. Okay. So once your dressing has been changed, I want to go ahead and take off my sterile gloves. I can clean up my area here and throw everything in the trash. I'm going to go and take her towel off. and make sure that she's got her oxygen mask back on. Then I'm going to lower her back down to earth so that she's in a safe position, that she has all of her belongings and her call light within reach. And then I want to go and document how she tolerated the procedure, how much secretions I got out and what their characteristics were. And then I changed the dressing on her trach and provided trach care for her at the appropriate time. So she did great. I think that that's it.